Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. More and more often, we're seeing nurse practitioners as part of the medical environment. The month of November brings with it Nurse Practitioner Week. My guests tonight are Oncology Nurse Practitioner Phyllis Everett and Urology Nurse Practitioner Jennifer Lloyd-Fitzgerald. They'll be telling us about the role of nurse practitioners in today's medical environment and just what nurse practitioners do. Jenna, Phyllis, welcome to Lynchburg Live. You know, as we get started, can you tell us the dates of Nurse Practitioner Week?
Nurse Practitioner Week is typically the second full week of November, and this year it is the 10th through the 16th.
Okay, so this will air a little bit after. You know, I'm sorry we didn't get you on earlier, but wanted everybody to know what the roles of nurse practitioners are and how important they are really beginning to be in the community, medical community. Now, does the American Academy of Nurse Practitioners have a theme for Nurse Practitioner Week? I am really having a hard time getting that word out, aren't I?
It is the nurse practitioner, your partner in health.
Now, could you tell our audience what's the difference between a nurse practitioner and just a registered nurse? You know, I don't want to make it sound like just a registered nurse, but...
A registered nurse is someone that is a nurse that can be prepared either at the associate degree level, the diploma level, or even a baccalaureate degree registered nurse. And they're licensed by the state. They take a state nursing exam when they're done. Nurse practitioners are registered nurses who have gone on to get advanced degrees, whether it's a master's degree or even a doctoral degree, and they are certified by a national board, and they apply for state licensure.
Now, isn't it an advanced practice nurse or an APN? Is that the same thing as a nurse practitioner?
A nurse practitioner is one advanced practice nurse. There are several in that category, such as certified registered nurse anesthetist is one, certified nurse midwives, certified nurse specialist are all in that category. Nurse practitioners are one in those advanced practice categories.
Now, how many additional years do you have to go to school in addition to the RN program to be a nurse practitioner?
You need to have a bachelor's degree, then you go on to a master's program, and then from there you can get your doctorate. They are starting to develop programs where a nurse can go straight from having her bachelor's through a doctorate, a 3-year program I've seen in some areas, so it's going to make that easier for people to get their advanced degree.
So how does that compare to like a medical doctor? I mean, you seem to be doing almost as many years.
It's not quite the same. The number of clinical hours is different.
Oh, that's where the difference
right.
is.
So, and if a nurse practitioner gets a master's degree and goes to take her certification exam, she needs to have had 500 hours of clinical experience. Someone at the doctoral level is required to have 1,000 hours of clinical. I don't know exactly the numbers for the medical community, but I'm sure they could share that with you if you wanted that.
I mean, I just think that it's great that you want to go on and do this. Now, how long have nurse practitioners been in the medical environment?
Nurse practitioners have been practicing for about 50 years.
Oh, that's great.
Started out in Colorado. We have been practicing in Virginia for about 40 years and are about to celebrate our 40th anniversary in 2014.
Now, where do you go to school? Do most colleges have a curriculum for nurse practitioners, or?
There are a lot of colleges that have curriculum for nurse practitioners. There's about 9 in the state of Virginia. I think there's about over 300 programs nationwide for nurse practitioners. And I think there's about 14,000 nurse practitioners that are graduated every year, and that's actually grown by about 70% over the last 10 years.
That's great. Is it necessary to choose a program that you're doing clinicals in a hospital?
No, usually the program that you're going to will help you find a place to get your clinicals if they're nearby. If you're in a school that has clinical sites nearby, if you're doing an online program,
the person who's taking the class is usually the one that's responsible for arranging those clinical sites, and so they work together to develop contracts with people that help them get the experience that they need.
Now, you told me, Phyllis, that is it LU that has a program here?
They're developing a DNP program that should open next year.
That's wonderful. I mean, I think that's so wonderful that people right here have that available to them if they want to do that. Now, are there nurse practitioners of every specialty? Like, I know there's medical, and I think that's where I kept getting that word, but in medical offices and GYN nurse practitioners, you're a urology nurse. So,
yeah, they're in lots of different specialties. You see them in gynecology, you see them in oncology, gastroenterology. So they cover many different venues. So they don't necessarily stay in just the primary care world, but also go into specialty practice as well.
Now, you nurse practitioners can fill the role of a primary care physician. Is that true?
Well, not a physician, a provider.
A provider.
So we are able to provide the same similar services for management of urgent care and chronic illness.
Did you always have to work directly under a physician or with a physician, or?
In the state of Virginia, we have a collaborative relationship and agreement with the physician colleagues. In some areas, they still are required to work under supervision. For instance, the nurse anesthetists do work under supervision of the anesthesiologist. But in some states, that's not required.
Now, can nurse practitioners operate a clinic of their own without a doctor being present on the premises?
Yes, in some places we have nurse practitioners who have their own clinics. In Virginia, for instance, they have to have a willing physician to collaborate with them in order to practice off-site of a physician. But then we have other people who work in other states who are able to practice on their own without a physician being present, or in a collaborative relationship that's legislated. That's what we have here, is where we're required to do that by our laws that are in place. In some states that's not required, and those relationships evolve naturally as you need people to help you with different circumstances with patients.
And I would think that most physicians would be really open to having a nurse practitioner in the office. It certainly helps with caseload.
I think that that has come over time. I think physicians, as they have gotten to know how other practices are utilizing nurse practitioners, they've become more comfortable with the idea and have thought about how that person could complement their clinic, and so they've hired more people.
Now, what kind of limitations do you have on what you can do as a nurse practitioner?
You have limitations based on the type of nurse practitioner you decide to become. So if you decide to become an acute care nurse practitioner versus a family nurse practitioner versus an adult nurse practitioner, so that really limits you in regards to the patient population that you see, the age range of the patients that you see. There are also limitations with the practice agreements and things within the practices, but you really set what the procedures and things that you're going to do based on your competency. So you have to show competency that you can perform certain procedures in order to be able to do those procedures in the office. And as long as you can show competency and it's within your scope, then that's something that nurse practitioners can do. For example, I do biopsies in my office.
That's what I was going to ask you. What procedures that you did?
Yeah, so in my office, I specialize in female urology and women's health, and I do biopsies, and so that's an advanced skill set that I have that I had to prove competency in and put on the practice agreement as well.
That's great to know that you can diagnose as well.
Yes.
I mean, you can do just about anything, it sounds like, and I think that's such a help to have in the office. Now, do you have to be licensed in each state in which you practice?
Yes.
I mean, I think most nurses are these days. Now, there's a group of people called physician's assistants. Did they have anything to do with, are they like nurse practitioners, or are they a whole different breed?
They're somewhat different. They do not require a physician's assistant to have a nursing background in order to go into school. So they can have a different type of background, such as biology or psychology, and then enter in a physician's assistant program and be trained more to be a help to the physician with procedures. So they're trained to do suturing or casts for orthopedics, things like that. So they are very task-oriented and work well in those situations. But they also serve as primary care providers, and they see patients within the hospital setting too.
They have a little bit different, they have a different training in the programs than what we do, and different structure to the program. And, we're very fortunate to be getting a doctor of physician assistant program in the community. Lynchburg College has applied for provisional credentialing for a program. And so they are advanced practice providers. They just go a different route.
And they don't have to be registered nurses before they go into this particular thing?
No.
Okay. You all have brought some pictures. And Phil, if you'll put the pictures up on the screen, we'll get them to tell us what they are. That's the first one.
As part of my role as the Virginia Council of Nurse Practitioners president, we are able to go to receptions with our legislators, and it's very important that we have this time with them to talk about issues related to the practice of a nurse practitioner and how we need to work together to expand our scope of practice and provide care to citizens of the Commonwealth. So.
Are they usually very receptive to you all?
Yes, they are.
Okay.
Yes, they are. So this is did some visits around the state as president, and one of the places that I went is the Elkton Family and Children's Medical Clinic. It's in Elkton, Virginia. It is a nurse practitioner-owned clinic. This is Mary Beth, and she is one of the people who work in the clinic. The owner, Pete Hill, was not able to be there the day that I came, but this is one of the places that is a model for a nurse practitioner-run and owned clinic, and he works in collaboration with a physician who works off-site and is available, to help us when we have other people who wish to do the same. So.
I think that's wonderful to have this clinic.
This is the South River Clinic. This is one of our nurse practitioners who has a place of her own as well. She opened this clinic along with another physician who is helping her to see patients, as well as she's done some chart reviews and consultations with her. But Ms. Kluger has also been to our state meeting and presented and talked about her clinic. She also is available to nurse practitioners who wish to also do the same. And it was her clinic that we saw in the background as we were talking. This is another of our visits on Legislative Day that's coordinated by the Virginia Nurses Association. These are some students who accompanied me around to visit our legislators, and they kind of got to see what that was like to go and talk about the issues related to being a nurse practitioner. This is our governor's proclamation for NP Week, and I have that here too. It is a proclamation just honoring and recognizing the work of nurse practitioners in the state, and we're very proud to have this. And I've been taking it around to different areas of the state as I've been traveling in the last few weeks. This is a group picture of a check that was donated by Dominion Power to the RAM Clinic. The Rural Area Medicine Clinic is out in Southwest Virginia. They have a clinic that runs over a weekend. It was featured on national news this year, and some of our legislators also came to that. Tim Kaine is in the back. Our Senator Bill Hazel, the Secretary of Health, is over here on the far right, and that's a couple of our nurses, Teresa Gardner and Paula Mead, who help run the clinic. They have the doctoral degrees in nurse practitioner, and they work out there at the clinic full-time and do fundraising and go take a health wagon around to different areas in Southwest Virginia that are underserved to provide care.
Now, is this a nurse practitioner-run clinic?
I would say that, but I think it's more of a national organization that helps them, or even international. They go all over the place. In fact, are taking a group to the Philippines with the recent devastation
there. Oh, how wonderful. I mean, the scope is huge that I didn't really realize.
This is Audrey Snyder. She helps coordinate the nurse practitioners who come to the clinic each year, and I got to meet her. She took me around to meet the nurse practitioners who were able to work at the clinic this year. In years past, the nurse practitioners had to work as registered nurses because their licensure and legislation and regulations didn't allow them to practice as nurse practitioners when they went to volunteer here. So this year, we were able to get people to collaborate with the nurse practitioners who wanted to go and volunteer, and for the first time they had a large group of nurse practitioners who were able actually to do all that they normally would do for patients. The Nurse Practitioner Week is also includes volunteer things that we do within the community. Last year we did a project with Reach Out and Read, where we actually purchased books and collected books through our region and took them. This is a picture of me down at the Johnson Health Center here in Lynchburg, where I took a book and read it to a patient who was there on the day that we went. We took our delegate, Matt Ferris, with me that day, and he also read to patients that day. This is our logo for our upcoming 40th year anniversary for the VCMP. It is the Ruby year, and so we've circled it in red, and it's very, very pretty.
It's a pretty logo. I put it on Facebook this morning.
This is a picture of the signing of our bill, HB 346, and Dr. Cynthia Romero on the right here, and Cynthia Fagan was our president of the VCMP last year, and they went and had the signing ceremony with the governor for our bill. Our patron, Dr. O'Bannon, is in the background there, along with members of VCNP and the MSV team that worked with us on the bill.
That's great.
This is just a picture of one of our conferences. We do an annual educational activity for the nurse practitioners. One of our main goals is to provide education, and we do a very nice conference each year, and we take it around to different areas of the state. This year we will be in Reston, Virginia in March, and the following year in Roanoke, and we were in Williamsburg last year. So we try to go to different areas to make it accessible to people. This is another picture from the legislative day from the VNA in February, and that was just a group of nurses who came to visit their legislators and bring information about healthcare issues to the General Assembly.
I'm so glad that our legislatures are open to and receptive to hearing from nurses.
This is one of the promotional materials for Nurse Practitioner Week for this week that is available, that we put out for people to know that it's our week and to remember what we do.
That's cool. Great. Phyllis, since you've already warmed up and you're talking, tell me what your job involves, as an oncology nurse practitioner.
We have 3 nurse practitioners who work in oncology currently. My role primarily is working with the physicians to see new patients who have blood disorders such as anemia or abnormalities of their white cells or red cells or clotting disorders. I also am certified in genetics, and I do testing of patients who need hereditary cancer testing. We as a group see patients who are coming in for treatment who need to have their blood counts checked before getting treatment, or help them manage symptoms that they're having related to their disease or treatment. One of our nurse practitioners does the chemotherapy counseling for patients who are getting ready to start new treatment, so they know what's ahead. And then we have a nurse practitioner who does survivorship counseling so that patients are ready to know what to expect for long-term side effects and survivorship follow-up with their different types of cancers.
You all provide quite a service, I think, having been down that road myself. Now, Jenna, tell me about what your job is like as a urology nurse practitioner.
I work in a urology clinic here in Lynchburg, and I've been there for over 11 years. And I really specialize in female urology, so I work with female patients that have urologic issues such as urinary control concerns. Pelvic pain is an area that I focus on as well. Dermatologic issues is an area that I focus on. I work with bladder cancer patients and provide the treatments for those patients. We also have another nurse practitioner in our practice that really focuses on prostate health and prostate cancer, and really work with our patients that have bladder pain and things that, you know, maybe they've struggled with for quite a long time and they finally found a place to go and get treatment.
You know, I think it's, when I was coming along, there were one or two nurse practitioners. It wasn't anything that is like it is today.
Mm-hmm.
And it might have been something that I would have been interested in doing had it been more available, or you know, we had heard more about it.
Mm-hmm.
So I do admire you all for what you do. Now, am I correct that we're seeing more and more nurse practitioners in doctors' offices like in the last 10 years?
Yeah, and you're going to continue to see that with the healthcare reform that's in place. You'll continue to see the number of nurse practitioners in all different settings rise. We have to figure out how to meet this need. Right now, we currently spend about 17% of our GDP in healthcare expenditure. And so we've got to figure out a way to decrease that cost and improve the quality of care that we provide. We rank about 34th in healthcare in the nation. And so we have to figure out what we can do to lower the cost, all the while improving the quality that's provided. So you'll see more and more nurse practitioners, more and more advanced practice providers in general within the primary care settings and in the specialty settings.
I mean, these really are challenging times.
Mm-hmm.
And I can see where having more nurse practitioners allows doctors to do, you know, more what they have to do, and frees up time in the office for them. And, you know, I hadn't thought about it until you all said about the healthcare reform that's coming along and how that's going to affect just healthcare in general. I guess it'll be a glut of people who haven't had insurance who is that
30 million.
Oh my goodness, that's a lot of people. So do you sort of call this a crisis? A healthcare crisis?
We certainly believe it to be coming. We know that there are not enough providers. With all the physicians and nurse practitioners and physician's assistants that are currently available, we know we do not have enough. So healthcare is going to be a very promising career for anyone who chooses it. And we encourage people to consider advanced practice provider roles because we know we need them and should be a good place for people to be.
Then I hope people who are listening to this show or watching this show will get that message,
Mm-hmm.
because it is, I mean, I've always felt like in healthcare, you pretty much can keep your job, you know, in bad economic times and that kind of thing. But here we're looking at something entirely different. We're going forward into something we haven't been into before. And, you know, that'll present its own challenges. And how close do you think we are ready to meet those challenges with the numbers of people we have now?
The practice of healthcare is very different than it was 10 to 20 years ago,
yeah.
where you have to be very much a business manager as well as a practitioner or provider in order to succeed. And that's why some groups have actually gone under the umbrella of the hospital to function, because they found that to be a more lucrative or salient place to be, because they were losing money as individual providers. They were not able to manage that any longer. So the environment has changed quite a bit.
Oh, I'm sure. I'm sure. Now, just generally, what is the perception, the public perception of the nurse practitioner?
Some recent studies show that people are becoming more comfortable with the nurse practitioner role, seeing nurse practitioners in a variety of settings, hospitals, primary care, urgent care, emergency rooms. About 2/3 of people now have seen a nurse practitioner. They provide about 916 million visits a year. So people are seeing us more, becoming more comfortable with the care that we provide.
You know, I just think it's great that you're there, but I just wondered if people still had the perception of you just being nurses, you know, who were there to give the shots and be in the office for exams and stuff.
Yeah, I think that perception is changing the more you see us in the practices. I know that the patients that see me understand that I can diagnose, assess,
Right.
diagnose, prescribe for them, and they appreciate the care that they get. And we're just one more component of that patient care team.
That's great. We're almost out of time, which is hard to believe. But I wanted to ask you, is there a chance for advancement as a nurse practitioner?
Within certain roles, there could be, as a professor, for instance, someone could get a tenured position, or in a larger hospital system, a person could be a manager over a group of nurse practitioners. But generally, it's based within the system where you work. There are roles within our Council of Nurse Practitioners, leadership roles within volunteer settings as well.
Yeah, you see in a lot of the larger organizations, they are even starting to have like chief advanced practice officer positions. Right. So you're seeing that more and more in the leadership position, and it's needed.
All right, tell me quickly, what has being in these roles meant to you all individually and very personally?
I think that for me, it's a very fulfilling role to be in. Whether you choose to specialize and be in primary care, we work very well to provide care to the whole patient, regardless of if we're in specialty versus primary care. And the patients are very appreciative of that care. And it's also very rewarding to be a part of this patient care team, you know, from the physician all the way through the whole office that you work with, to really coordinate and try to deliver good, quality, safe care to our patients.
You pretty much...
I agree with that. I wish I had been able to do this sooner. I love my job. I love my work. I like my role. I like what I'm able to do for patients. I'm very proud to serve as president of the Virginia Council of Nurse Practitioners. It's a wonderful group and talented people that I've gotten to meet across the state, and it makes me very proud to work with all of them. I think it's important that people know that the quality of care that's provided by nurse practitioners is equal to or above what they can sometimes receive in other settings, and we certainly want people to know that they can feel comfortable receiving care from nurse practitioners, that we have the information out there that says that we do a good job, and we want people to feel comfortable being our patients.
If a new graduate nurse is interested in looking into the nurse practitioner program, where would she go to do that?
I mean, you can go to any of the schools that currently have programs. They're very interested in talking to people that are interested. You can reach out to the VCNP, because there are plenty of us that really want to encourage. We need more. And so I would say find a good, positive mentor to help lead you in the right direction.
I thank you both for being on the show. I think it's wonderful what you do, and I'm so glad to be able to focus on that and let the public know more about nurse practitioners.
We appreciate you having us.
Thank you so much. I hope you've enjoyed tonight's show. My next show will feature the Mysticon Science Fiction Convention. Thank you for watching. Have a wonderful evening. Good night.